Hello friends, dental implants have been enjoying a great run with a great success rate. However, marginal bone loss has been a big concern for long, and researchers have been trying to identify how we can minimize or prevent marginal bone loss. And one of the compelling pieces of evidence points towards implant abutment connection, the microgap, and even the cover screw chamber. How these areas can acquire microbes in the early phase. So initial microbial colonization is turning out to be a critical factor in creating localized inflammation and the resultant tissue loss. Now over the years, several studies have demonstrated how a simple technique of applying chlorhexidine gel to the threads of cover screw can reduce the initial microbial colonization and thereby prevent resultant bone loss. Now, a recent study which was published in 2023 showed a 5-year follow-up of their earlier study. The earlier study had shown how chlorhexidine gel application to the cover screw threads can prevent initial microbial colonization and the resultant bone loss for up to 12 months. Now, when the same sites were followed up for 5 years, they showed that the bone loss reduction, the reduced bone loss was maintained for 5 years. So the advantage of applying chlorhexidine gel and reducing the microbial colonization in the initial phase will be maintained for up to 5 years, which is a great result. So clinicians should look at how they can utilize a simple, cost-effective technique such as applying chlorhexidine gel to the cover screw threads to prevent initial microbial colonization, the resultant inflammation and the subsequent marginal bone loss.